Hello, folks. This is Kevin from Good Day, Good Prayers. One of the reports that I did during this past week had to do with the fact that the scientists that are missing were actually taken to Cheyenne Mountain, and they were working on the med beds, getting them prepared for human use. There are some things that I can give you that will help to update the story. First and foremost, I believe that there are a lot of those scientists that have been working on the med beds, getting the med beds that were taken from the deep state, the globalists, and then going ahead recalibrating them for human use. And I think that that's been happening on a regular basis right along. But I also believe that there are companies, corporations out there that are building med beds and have been doing for quite some time. There are people that have actually spoken about the fact that they know somebody who is working in a factory that's doing predominantly med beds. I also know of people in various facilities, these facilities being healthcare type facilities, where they are saying that, yeah, there is a floor such and such, nobody is to go there because of the fact that those are being set up as medbed centers. And so the only way that you can go to that part of the hospital or the healthcare facility is when you are invited. Now, there are certain things that they are going to be looking at in order to bring a person in to become a technician. I think, and this is my opinion, that probably the medbed technicians are probably going to be military personnel for quite some time. But there's going to come a point, and it may already have begun, where people who are civilians are going to be going ahead and becoming a part of the medbed technician facility. There will probably be some doctors that will be going in there, and some nurses, and some technicians. And there's probably going to be a training program that's going to be set up, whether it's a training program that winds up in a college or a university. I kind of doubt it. I imagine it'll go through the military. And the people who do have the medical training, that have the medical training for the way things are done right now, a lot of them are going to have to be retrained. You're going to see a lot of people that are just simply going to get out of the profession altogether because in their mind they're too old to be able to start over. But I think that some of them might come back eventually when they start to realize just exactly what the benefits of the med beds are. If one day you think, well, I've got another 20 years on this earth, and the next day you're in a med bed and now you're thinking, you know what, I may have 70, 80, 90 years left. I may have 150 years left. And I like medicine, and I think I'm going to go ahead and be retrained and become a part of it. So there's a lot of aspects to all of this, and everything is going to change. If you believe that you know what is happening today, it's going to be very interesting because nothing is going to be the same. The ideas of what we do as far as finance is going to be different. Economics is going to be different. The way that people are governed is going to be completely different. And the medbed centers are going to change the former radicalized medicine and turn it into something that is much tamer and much more acceptable. This is Kevin from Good Day, Good Prayers, and you have a good day.